Hi, welcome to another edition of the Lynn Lowdown. Today, we are joined by Norris Guscott, the Public Health Coordinator and Food Security Task Force Leader for the City of Lynn. Thanks for joining me.
Thank you so much for having me, Dave.
So, we're here today to talk about a bunch of the stuff that the Public Health Department does. But you're a big part of that department too. So what is it that you do over there? You wear two hats. So what do you do with each of those hats?
So breaking it down, the public health portion, like my job as the coordinator is to assist the public health director extremely closely with this entire city's public health portfolio. So that's regulations such as like food, housing, that's food, that's housing itself, that's substance misuse, the whole gamut. So, and in that realm, I'd call that the more state-appointed roles of public health. Now with the Food Security Task Force, as task force leader, simplifying that, I and the task force help to safeguard the entire city's food security. That's access, education, that's delivery, that's the resources that our city, city's residents, the most vulnerable, need anyways.
And having the public health department here, I'd be remiss if I didn't mention that the public health emergency for COVID just ended. So that is going to make a bunch of changes, and we were talking beforehand about this a little bit, and some changes you kind of know, some changes you kind of need to find out how everything's going to play out. But would you say that the emergency ending is going to affect the department right now?
So speaking to that, as you said, some of that information has happened, and we'll see how that's going to impact Lynn residents. For example, we've got to start paying our student loans again. That's not really public health related, but in the public health sense, there are certain restrictions that go away. There are certain resources that get cut a little bit. We know that SNAP, for example. We also know that some schools around the state, whereas it used to be universally free during the pandemic, that some school systems are no longer offering that. There are definitely, I think to sum it up, changes are coming. A big part of that is the health division relaying that information to Lynn residents, and the health division itself being able to respond to the changes that happened. For example, when we found out about the SNAP cuts, we put that on our social media and we put it out into our networks, and we made sure that folks were aware of that. And so the answer to that is twofold, is that we know some changes are coming, and the others, we'll see how they impact the city, but the health division stands prepared to respond to that or whatever changes happen.
Yeah, so definitely if people want to know more about that sort of stuff, definitely reach out to the department, pay attention to what they're putting out. We also put out a lot of information too, like about the SNAP benefits being reduced.
Thank you.
We also put out something about that.
Appreciate it.
Because a lot of people also just don't know that stuff is happening.
Quite right.
But we can move on to the next thing, because I think everybody's kind of tired of COVID talk, to be honest.
Oh, yeah.
A lot of stuff that you do has to do with social and clinical health as well. So what is the connection between those?
So let's start off by explaining what each is, because they're both really important areas of public health. So clinical, the clinical determinants of health, or clinical operations, that's vaccinations, that our public health nurses seeing their TB patients, that's epidemiology and monitoring disease prevalence. Those are the more scientific, quantitative pieces of public health. Social determinants of health looks at places where, or indicators such as where someone is living, where they worship, what they're eating. just there a lot more focus on the conditions in which they're living that impacts their health. So the Public Health Division under Director Damaris is really keen on, in addition to the clinical determinants of health, that we're paying a close attention to the social determinants of health, because that impacts Lynn residents quite a bit. You know, we have housing issues, we have substance misuse issues. I mean, what city or what municipality doesn't? You know, we have social determinants overall impact our city greater given a variety of factors. And so we as the Public Health Division, we've got to note that. And you'd see even the Food Security Task Force itself is a response to addressing those social determinants of health, because that's a direct correlation to, you know, what you're eating and your health. We also have, excuse me, so we also have our opioid settlement working committee, headed by our opioid prevention specialist, Candace McClory, and public health nurse, Jennifer Almonte, and the community as well. You know, recently there was a settlement for opioid, well, the companies that made the drugs that ravaged certain parts of America, and the city is getting some of that funding, and this working group comprised of, you know, city officials, organizations, and folks in the community are looking at how that's going to, how they can use those funds super impactfully. Our resource room, newly open, for example, Lynn residents can come into there and get care kits. Those care kits have toothbrushes, brushes, soap. You know, we've given away, or not even given, but we've offered clothing. There's tons of information. There's COVID test kits. And so you see the social determinants of health really look at the environment and the other factors, whereas clinical determinants of health, just as equally important, looks at the direct care. Yep, so hope that, I know that was a bit convoluted, but I hope that explains it clearly.
Well, it might sound convoluted, but it's all interconnected and complicated, so it's a long answer.
Yeah, right. There's no short answer to that at all.
Maybe this one might be a little bit shorter, or maybe it'll be just as long, but there's a community food assessment that you guys are working on. Would you be able to talk a little bit about that?
Absolutely. Before the community food assessment, though, I'd be remiss if I didn't mention the community health assessment, which is happening now. You know, the Public Health Division, in partnership with MAPC, we are doing a citywide assessment to see what's going on, to see what's up. Like, for example, how are folks faring in terms of the clinical and social determinants of health? They're asking about access to different resources, you know, conditions in which they might have, where they go. And when I say they, MAPC interviewing many different organizations and folks who those organizations see, so we're really excited for that data. That's going to be able to shape our interventions, how we approach different programs that we offer for Lynn residents. I'm really excited thinking about that. That would also pave the way for us to be able to, you know, spend funding and state grants more effectively and more impactfully. So that informs the community food assessment in the sense that the community food assessment is roughly the same thing, but in the realms of food. So it's taking a really, really deep dive, and it's looking at things like, you know, how far families live away from grocery stores. Do they struggle to pay for it? Do they have the background and knowledge into preparing healthy foods? You know, what has their relationship with food bins? You know, it goes, long story short, it goes really in depth into the food security issues that folks might or might not be facing in the city. And again, this Food Security Task Force leader, that would inform our interventions, our funding mechanisms, and the programs and resources that we're offering to Lynn residents and organizations to shape more impactful interventions around food. So that's what the community food assessment is going to be doing.
We only actually have a few more minutes, but you were talking about some of the programs in relation to food and food security, and I know one of the things that you guys are doing now is food delivery. And you've talked about expanding that program. So would you be able to just talk briefly on that? If people want to take advantage of the food delivery, how do they do that?
So they would get in touch with, so there are a few different options there. The health division itself is in the stages of getting a mobile health vehicle. We'll be out in the community, and you might see me pulling up and delivering food to folks who need it. But now we definitely utilize, and this is what makes the food security task force is so amazing. So our amazing organizations, the folks who have been engaging with the most vulnerable, they are the ones that are delivering and have expanded with partnership and funding and guidance from the city. But for example, you have New Lynn Coalition, who is the backbone of that. You have the Salvation Army itself. They don't deliver, and at the same time, it's at a central location where folks can come. I know Phoenix Food Hub, I'd be remiss if I didn't mention Phoenix Food Hub. They have Phoenix Food Hub is a one-stop shop for all the social and clinical determinants of health related to food. And so in Phoenix, we have a teaching kitchen, we have programming space, we have a pantry in Catholic Charities, it's there. And we also have a food storage area built with a loading dock for trucks. And so the current delivery levels, that's a mix of what we have now, which is New Lynn and different organizations putting their hand up, which was considering where that was at the beginning of the pandemic. That has definitely expanded, and we are expanding even as we speak, because once we get that truck, once certain funding goes through to different organizations, we'll see them taking on more of a delivery load. And once we get our van, even the health division ourselves will be able to get to our residents. So that explains the expansion on the food delivery piece, which is super vital in our city.
And so now we've it's insane how fast the time goes. We've already been talking for a little over 10 minutes.
Oh, wow.
So we only have maybe about another 2 or so left. But for people that want to know more, one of the things we were talking about before the show too, and thank you, Pedro. Our director in the back, Pedro, also goes out and covers a lot of city meetings, one of them being the Board of Health meetings. And for people that don't know, we do go out and film and record and broadcast a bunch of the city meetings, license commissions, zoning board of appeals, and like I said, Board of Health. So that's obviously one way that people can find out what's happening. But how else are you guys sharing information and staying connected with the community?
So thanks for that, and a huge shout out to Pedro, because he is definitely at all of those meetings. He does a phenomenal job, and he also shares the belief that it's important for folks to know what's happening here for a variety of reasons. So shout out to Pedro. How folks can, so we put information regularly out on social media. In our resource room, we definitely have pamphlets of information, and folks are always free to come in there and speak with us. But the most, and our website, but I'd say the most nuts and bolts, the most simplified way of finding out what's going on in terms of the public health division and food in general, it would be to attend those Board of Health meetings, because it covers everything from sanitary areas such as food licensing, dumpster licensing, food security issues. Just recently, we're looking at an ordinance that would make it easier for food donations, everything in between. And I would point out to what Pedro and yourself just said, the Board of Health meetings is a super easy way to find out what's going on. It's recorded and it captures everything. And I just want Lynn residents to realize that this City Hall is theirs. We are accountable to Lynn residents, and so these meetings are for them to know what is happening, and I encourage everyone to come down to the Board of Health meetings and find out what we're up to.
Right. Before we leave, though, anything else that you want to get out to everybody watching?
The City of Lynn's Public Health Division has Lynn's back, and we are, reach out to us if if you think we can help with anything, even if you don't. We're happy to serve our residents, and we're looking forward to the great things to come. We've got lots of great programmings coming up in the future.
Right. Awesome. Thank you again very much for joining us. Again, if you guys have any thoughts, comments, questions, anything like that, reach out to the Public Health Department. We've been putting their info at the bottom of the screen, but also lynnma.gov. You can go down to City Hall and see them in person. And obviously, like we were saying, Board of Health meetings are on our website, lyntv.org. Go and check them out. But that's it for this edition of the Lynn Lowdown. Thank you very much for joining me, Norris.
Thank you, Dave. It's been a pleasure.
All right, and we'll be back next week with more guests.